Namaste. This is a traditional Hindu greeting, which means I'm bowing down to the divine in you. Welcome to an oral presentation reviewing my version of Integrative Therapy, incorporating neuroscience and Asian counselling theories of yoga, mindfulness, and meditation. How do these ideas integrate? First, what is neuroscience and how does it relate to counselling? Neuroscience explores how the brain controls thinking, behavior, and emotions, and how the brain reacts to such things as physical or mental illness, trauma, and substance misuse. It integrates perfectly with ideas about holistic approaches to well-being. When I began research for an historical overview of neuroscience, I had no idea what I was getting into. Let me try and navigate our way down the rabbit hole. The ancient Greeks were among the first people to study the brain. They attempted to understand the role of the brain and how it worked, and to explain neural disorders. Before Christ, Hippocrates discussed epilepsy as a disturbance of the brain and stated that the brain is involved with sensation and is the seat of intelligence. Neuroscience emerged because of the work of many who wanted to shed light on the structure and communication of the nervous system and its links to more complex behavior. It emerged from the biological sciences. Luigi Galvani introduced the concept that electrical current could initiate responses in nerve and muscle in 1791. He studied medicine and philosophy and was appointed lecturer in anatomy at the University of Bologna. Using the Leyden jar, he was able to generate voltage and discovered that the production of a spark caused muscles to contract. Pierre-Paul Broca was a French physician, surgeon, and anatomist. He worked with patients who had brain damage. He concluded that different regions in the brain were involved in specific functions. The part of the brain known as Broca's area is responsible for some speech and other functions. Damage to this area during a stroke can lead to Broca's aphasia, when a person can no longer produce accurate or coherent speech. Neuroscience is an interdisciplinary science that works closely with other disciplines such as mathematics, linguistics, engineering, computer science, chemistry, philosophy, psychology, and medicine. Researchers might investigate brain activity in people with ailments such as Alzheimer's. Tools used include MRI scans and computerized 3D models. They may do experiments using cell and tissue samples. The findings may lead to the development of new medications. Some neuroscientists are involved in treating patients. It affects many, if not all, human functions, but it also contributes to a better understanding of a wide range of common conditions. These include Down syndrome, ASD, ADHD, addiction, schizophrenia, Parkinson's disease, brain tumours, epilepsy, the effects of stroke, for example language loss, immune system disorders such as MS. Over the past 100 years, 5 key forces have influenced the direction and philosophy of counselling. Neuroscience is on track to become the 6th force. Each force offers counsellors important perspective, knowledge, and guidance. 6 key forces in counselling are psychoanalysis, which focuses on helping clients develop understanding and insight regarding the origins of their thoughts, feelings, and behaviour. Behaviourism, which looks at human behaviour as a product of learning and the environment. Humanism is based on the philosophy that people are innately driven towards growth and fulfillment. Multiculturalism involves framing counselling interventions in the context of the client's cultural worldviews. Social justice recognises the importance of counselling professionals working to help establish more equity regarding the distribution of wealth, resources, and opportunity. And finally, neuroscience explores the electrical and chemical activity of the brain using a variety of experimental and brain imaging techniques. Bear with me while I explain why Asian counselling therapies like yoga, mindfulness, and meditation are the perfect complement to a neuroscientific approach. In the beginning, there was darkness, and darkness was covered with darkness. Then came the light with the sound. And Om gave rise to words or knowledge, which was compiled as the Vedas. Om is the combination of three powers: Brahma, A, Vishnu, U, Shiva, Ma. Om. The Supreme Spirit or Universal Truth called Brahman is represented in three forms, each corresponding to one cosmic function. Brahma, the creator, Vishnu, the preserver, and Shiva, the transformer or destroyer. Of the three incarnations of Brahman, Shiva has a special place in the yogic traditions as he's considered the first yogi or Adiyogi. Shiva also symbolizes the balancing of awareness and bliss and the calming effects of yoga practices in general. There are four Vedas: Rig Veda, Samveda, Yajurveda, and Atharvaveda. The word yoga comes from the Sanskrit word yuj, which means union of the individual yoga practitioners and universal consciousness. The Rig Veda is one of the oldest and most sacred books in human history, having been written 8,000 to 10,000 years ago. Classical yoga is a part of this Vedic literature put forward by Maharishi Patanjali nearly 5,000 years ago. In Patanjali's Yoga Sutras, he explained 8 limbs of yoga practice: yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, and samadhi. Classical yoga encompasses different schools of philosophy. Of these, the art of asana is part of the Hatha yoga tradition. Somehow, in today's age, yoga practice has come to be associated with only Hatha yoga physical postures, whereas the central teaching of yoga philosophy is maintaining an equanimous state of mind. Yoga is an ancient practice that teaches us to master certain asanas with breathing and full awareness of body sensations and breathing techniques, and dhyana. The word yoga comes from yuj, a Sanskrit word which means to join, referring to the unity of body, mind, and spirit. Yoga is comprised of asanas, pranayama, and dana, which are intended to unite body, mind, and spirit. Yoga practice isn't just exercise. It's skillful communication and action in any given situation. The ability to remain centered in adverse situations is yoga. Whatever brings us back to our nature is yoga. While physical practice of postures makes the body healthy, pranayama and meditation take the mind deep within. Mindfulness helps the brain to refocus, decrease worry, increase working memory, and decrease stress. Exercise helps to slow cognitive decline. Yoga therapy is a type of therapy that uses yoga postures, breathing exercises, meditation, and guided imagery to improve mental and physical health. The holistic focus of yoga therapy encourages the integration of mind, body, and spirit. Modern yoga therapy covers a broad range of therapeutic modalities, incorporating elements from both physical therapy and psychotherapy. Stress management, having positive relationships, spirituality, and mental stimulation, increase neurogenesis. Social interaction stimulates the brain's reward circuitry and the release of dopamine and oxytocin, neurotransmitters that increase motivation, feelings of well-being, and levels of attachment and trust. The counselling relationship, recognized as the most important catalyst for client change, creates the conditions for healing damages created by stress and supporting the growth of new neural pathways, fundamental to wellness and mental health. Neuroscience provides guidance on medication. Knowledge of how medications enhance, inhibit, or augment brain and bodily functioning is essential for assessment and goal setting with clients. For both counsellors and clients, neuroscience provides the science that supports the use of techniques such as CBT that harness the brain's amazing neuroplasticity to form new neural pathways to replace and extinguish unhelpful and harmful thinking and behavioural patterns. Though findings are positive that yoga and mindfulness training for conditions such as ADHD, insomnia, anxiety, and parent-child relationships is feasible, acceptable, and beneficial, more well-designed studies and analysis are required to establish the potential of this type of intervention. Due to variables such as the absence of control groups, small sample sizes, and limited follow-up assessment, confirming the clinical effectiveness of yoga and mindfulness on ADHD, for example, is difficult. Further extensive methodologically rigorous research is needed to verify the effectiveness of yoga on ADHD and other neurological disorders. Spirituality is an ethical consideration which would need to be addressed with clients who are not comfortable with Eastern religious beliefs. Most counsellors are not experts in neuroscience, so they must be careful that they do not exceed the limits of their competence in this area. They need to refrain from giving medical advice or offering opinions on neurological issues in which they are not qualified. Neuroscientific research reports can be difficult to understand and absorb, and this results in a disconnect between the empirical results of science and their application to field practice. Owing to its relatively new status, many research questions have begun to appear, not least of all those relating to law, specifically how neuroscience is used in legal contexts. This and the use of psychopharmaceutical methods for reducing, restoring, and enhancing responsibility were two main international collaborative research project plans that came out of a meeting of experts in philosophy, neuroscience, psychology, psychiatry, and law in the Netherlands. Neuroscience, as the image demonstrates, is the study of the nervous system, which includes the central nervous system and the peripheral nervous system. A growing body of neuroscience research is providing counsellors with scientific proof of the value of their work, as well as guidance on which counselling strategies are effective in given situations. Ivy and Zalek discuss how neuroscience has confirmed the effectiveness of the mainstays of counselling, listening, empathy, and a focus on wellness. Furthermore, it's providing specific guidance on how to promote neurogenesis. It supports the efficacy of counselling strategies that include exercise and diet. A strong argument for counsellors to encourage clients to add these lifestyle changes to their action and recovery plans. Yoga, meditation, and mindfulness are gaining promising empirical support as a potential intervention for ADHD and other disruptive behaviour problems. Barkley makes it abundantly clear in his video about managing ADHD in children and teens that they are more likely to get tasks done and have better motivation if we build in some movement. Yoga, meditation, and mindfulness are usually used as behavioural interventions. In Townsville, Youth Reset is a 5-part program for young people 12 to 18 years and the adults who support them. It consists of self-care strategies to develop self-awareness and self-regulation through body, breath, and mind practices. Schools host the program either before, after, or during school hours. Clients may be referred or attend voluntarily. Counsellors well versed in neuroscience can inform and refer clients to take advantage of rapidly emerging technology. For example, virtual reality can be used to rewire the brain to deal with pain management. Techniques such as biofeedback and transcranial magnetic stimulation, the use of magnetic pulses to stimulate the brain, is an effective alternative to medication and has proved very useful in treating depression, including for those who have not responded to medication. Neuroscience provides explanations that can be used for psychoeducation. For example, research has demonstrated that excessive anxiety might be due in part to an overactive amygdala. This knowledge can form the basis of a simple explanation that can help a client understand and deal with their anxiety. In an article that summarised the 208 evidence-based conclusions for the treatment of ADHD in the World Federation of ADHD International Consensus Statement, the recommended therapy was the use of stimulants such as amphetamines. When pharmacotherapy proved unsatisfactory or unacceptable, supplements and dietary modifications were associated with small reductions in symptoms. Exercise was found to limit anxiety, depression symptoms rather than hyperactivity, impulsivity, or inattention. Behavioural treatments were recommended, although these differed according to the age of the patient. There was insufficient evidence for meditation or neurofeedback. Overall, medication was found to be more efficient than non-medication treatments for ADHD. However, non-medication treatments were helpful as augmentation for residual symptoms after medication treatment. Thank you for your time.